So today I'm going to demonstrate how to properly do an ABG. So first I'm going to receive my order. I'm going to do a chart review to confirm the order. I'm going to look to make sure that the patient's on an anticoagulant or has any injuries or anything that would interrupt or reason me not to perform the ABG. I'm also going to look to make sure that they haven't had any vent changes, I'm sorry for my stumbling, vent changes within the last 10 minutes or 25 minutes if they have any lung disease, and I'm going to then obtain my equipment if everything checks out fine. So I'm going to need my ABG kit, my alcohol prep, and my gauze. So I got that. So I'm going to knock on the door. I'm going to identify the patient, identify myself, and introduce myself by department, and explain the procedure. So, knock. Hi, Mrs. Arm. My name is Kristen from Respiratory. I'm here to get an ABG sample from you. If you have any questions over the procedure, just let me know. Okay, she has no questions, so we're good to proceed. So I'm going to go wash my hands. I'm going to put my nice gloves on. Okay. Alright, so before I take the ABG, I'm going to perform an Allen's test. Okay. Alright, so I'm going to ask Mrs. Arm to make a fist. If she can, I'm going to move her fingers. I'm going to put pressure on her radial and ulnar arteries. I'm going to wait for her hand to become flushed. Once it becomes flushed, I'm going to remove my hand off the ulnar artery and have her release her fist. The color has returned to her hand, so that means it's a positive Allen's test, so I can proceed with the procedure. Okay, so I'm going to open up my ABG kit, get that all nice and ready. Ready? I'm going to take my alcohol swab. I'm going to go in a circular motion while cleaning the area. Or I'm going to first, before I clean it, make sure I can feel a pulse, my strong pulse. Okay, so it's nice and strong. I'm going to take my alcohol, go in a circular motion, cleaning it. Okay, then I'm also going to clean my index fingers and middle finger. On my non-dominant hand, where I'm going to be feeling for the pulse. I'm going to feel. Okay. Take my syringe. I'm going to make sure the bevel side is up. Okay, and then I'm going to slowly insert my needle. Okay, you see a flash. I'm going to let it fill the syringe. I'm going to get my gauze ready. Once it's filled, I'm going to quickly take it back, close off my needle, and apply pressure to the area for at least 5 minutes, so there's not any harsh bruising. Put my cap on, push all the air out, and then I'm going to rock and roll it to make sure that the heparin gets evenly distributed so we don't get any clotting. Pretend 5 minutes has gone by. I'm going to make sure she's not bleeding anymore. If she wants a Band-Aid, I can put a Band-Aid over the site. If not, I'm going to clean up my mess, put this in a bag, labeled, a biohazard bag, not just any bag. Okay. Then I'm going to ask Mrs. Arm, how are you feeling? Do you have any questions over the procedure? Okay, you did great. I'm all done. Thank you again.